Thank you, Presiding Officer. Every life lost to addiction is a tragedy, and I know the Scottish Government is absolutely committed to implementing approaches that we know work to save lives and reduce harm. We must remember at all times that people with a substance use disorder are family members, neighbours and people in our communities. And instead of criminalising people in our population, we do need a public health approach that supports those with substance dependency and prevents unnecessary deaths. The Scottish Government is under no illusion about the seriousness or scale of the challenges that we need to pursue new, bold ideas and innovative approaches. In January 2021, the Scottish Government set out a national mission to improve lives and save lives, at the core of which is ensuring that every individual is able to access the treatment and recovery they choose, recovery that will work for them. We must empower more people to seek support, and we must make that support more consistent, flexible, effective and much faster, and we must help services to stick with the people whom they support. I welcome that the Scottish Government is committed to listening to people who have real-life experience of harmful drug use, to those who live or have lived with substance dependency and their families, and the families that actually really support their loved ones who are suffering from substance dependency. Indeed, an additional £250 million has been allocated over the next 5 years to improve and increase access to services for people affected by drug addiction. And all this is welcome. I also welcome what the Minister has just described with the 4 pillars of a Stigma Action Plan. Problematic substance use is a health condition, but the stigma associated with it can have detrimental consequences for the individual, their families and the wider community. And today's debate is about tackling stigma. It's an essential step in reducing drug-related deaths. The Drugs Deaths Task Force paper, the strategy to address stigma of people and communities affected by drug use, has described extremely well what stigma is and who is affected. The association between substance use and personal deficit allows the use to be portrayed as a failure of character or morals. This is an ideological framing of a problem substance use as a solely personal issue. This justifies and reinforces stigma. The Drugs Task Force developed a stigma charter that all organisations, including businesses and community groups, can use. And the Charter aims to create a Scotland that is free from stigma in order to support a public health approach for problematic substance use. However, we do need more action to deal with stigma and raise awareness of it, particularly among healthcare professionals. The Chamber knows I worked in the Scottish NHS prior to coming here, and I have witnessed myself, and I still hear recent feedback from former colleagues, that the words junkie, druggie, alkie, jakey are still used in healthcare. And use of these words is not acceptable, whether in a clinical area or by professionals away from the professional workplace. And we should call it out. But we also need to ensure the staff are properly educated. The Minister will be aware that I recently wrote to NES, National Education Scotland, to seek whether a relatively short online module was or could be created to address drug-related stigma, not just for professionals working directly in alcohol and drug frontline services. I was interested to know whether education could be targeted at all healthcare staff, pharmacists, nurses, doctors and allied health professionals. People with substance misuse health issues will encounter healthcare which is not solely addiction services, so tackling stigma is essential for everyone. The response I received from NES was a bit disappointing. NES said, and I quote, "Currently there is no dedicated resource solely for addressing the issue of stigma related to alcohol and drug use. However, stigma is incorporated in a number of our other resources." So I searched the online tourist education portal and I found a couple of modules with the word stigma, but these were not alcohol or drug focused. And NHS Inform have some absolutely great comprehensive info which could just be lifted and used, maybe even as a mandatory module. So I've responded to NES back to seek further information, to ask for a specific education on substance misuse or alcohol harm, and I've asked the Minister if she would maybe consider meeting with me to discuss whether a basic, short, online learning module could or should be created and then delivered. The strategy from the task force, it also asks who should lead on the strategy to tackle stigma, and groups like alcohol and drugs, other alcohol and drugs bodies are mentioned, like the ADPs, Scottish Drug Forum, Scottish Recovery Consortium, Scottish Families Affected by Alcohol and Drugs, and the third sector. But NES is also mentioned. The strategy document goes on to state that working with mainstream services is required. Specifically mentioning frontline staff and management is used in the document. And it says that we need to understand the causes and drivers of problem drug use and recognise their role in stigmatising people with drug problem. So that's a direct reference to mainstream services. So again, I'd be interested to hear the Minister's thoughts on this. Presiding Officer, I welcome the steps that the Scottish Government has taken to tackle harmful drug use, to reduce stigma, and I look forward to hearing the other contributions this afternoon. Thank you.